Welcome to the FAQ video, where I go through 18 of the best questions and answers from our FAQ at wholewashington.org, brought to you by Whole Washington for Universal Healthcare in Washington State. First, what is the Washington Health Trust? The Washington Health Trust would establish the first statewide, publicly financed, not-for-profit healthcare system in the U.S. Instead of multiple private insurance companies and multiple programs, the Washington Health Trust would pay the healthcare expenses of all Washington State residents as a single payer. This legislation was written by citizens, for citizens, free from the influence of corporate interests. Our goal is to provide comprehensive, universal health care, cradle to grave, with nobody left out. Who is eligible? All residents of Washington State are eligible. Resident is defined by the Healthcare Authority. The unemployed and homeless are covered. Those traveling temporarily out of the state are covered. Those living here for a temporary job are covered. All children and dependents are covered. And those on Medicare, Medicaid, and Apple Health will receive extra coverage from this. Some non-residents are also eligible, including students attending college within the states, non-residents employed within the states, and spouses or domestic partners, dependents of eligible non-residents. What coverage is included? The Washington Health Trust is a single and comprehensive benefits package. It provides inpatient and outpatient care, 24-hour emergency services, prescription drugs, medical devices and biological products, mental health and substance abuse treatment, reproductive care, maternity, newborn, pediatric care, rehabilitative care, occupational and physical therapy, palliative and end-of-life care, dental, audiology, vision, and acupuncture, and some massage and other healing therapies also included. What are the main benefits of universal health care? The first one is savings. There are no copays, deductibles, premiums, medical bills. You're also able to seek care without any financial stress. There's no longer a decision of, can I afford to go to the doctor? It's now just, you go to the doctor when you need to see. Freedom. Your healthcare isn't tied to a job. You're not locked into a job you don't want just because you need healthcare, and you can see the doctor you want because there are no insurance provider networks. So the last one is peace of mind. There's no more confusing healthcare plans. You don't have to decide which one's right for you, higher low deductible, higher premium. You can focus on healing, and you and your family won't be punished for illness or injury. Universal healthcare is simple, stable, and truly supportive. How is the Washington Health Trust funded? Employers will contribute 4.5% to 10.5% of wages. It's actually 2.5% to 10.5% because employees are responsible for 0 to 2% of that. So at the very smallest businesses with less than $1 million in gross annual profit, they would be paying 2.5% to 4.5%, depending on whether or not they cover the employee part. Employees are always 0 to 2% of all these categories, so 8.5% to 10.5% for businesses over $3 million. That's how that would work. Sole proprietors just pay that 2%, very similar to what the employees would pay under the employer section. And investors would pay, as of right now, 5% from $200,000 to $250,000, and then 2% in addition to the 7% put in by Washington State for education to make it 9%. And Washingtonians will spend less on healthcare, even with the better coverage and more people covered with the Washington Health Trust, because we get huge savings from reduced administrative costs. Will the Washington Health Trust save Washingtonians money? Yes, absolutely. Both an independent study by Dr. Gerald Friedman and the Washington Healthcare Authority, which gave a more pessimistic study, but still concluded that we would save money by transitioning to universal healthcare despite more people being covered. To give you an idea of the percentage savings for Washingtonians, overall healthcare spending is projected to go down between 5% and 15%. So a fairly significant amount of money would be saved. And if you look at the graphic on the page there, you can see in our current system, about 66% of all healthcare spending is going to providers. It is projected that Under single payer, 82% of money would be going to providers. So significantly more money would not be wasted by our system, but would actually go to the doctor. What is single payer healthcare? Single payer healthcare refers to a publicly financed system with universal coverage for all medically necessary care. Healthcare is financed by one entity or one payer. In this case, it would be the Washington Health Trust, which would be the one payer. Our current system is multi-payer because multiple private insurance companies, government programs, and private individuals paying the doctor all pay for medical bills. And that's a multi-payer system as opposed to a single-payer system. Will I get covered if I get medical treatment out of state? Absolutely. Qualified out-of-state providers can negotiate for reimbursements. Enrolled residents who are temporarily out of state will be covered to see out-of-state providers for emergency services. Public Trust has the authority to include out-of-state providers beyond emergency services in addition. I have private insurance now. Will my coverage get worse? Nope, it will not get worse. The Washington Health Trust will have better coverage with no out-of-pocket spending, and private insurance will still be available to those who want extended coverage. We're not outlawing private insurance. All we're doing is providing a better option. Will the Washington Health Trust help workers in the health insurance industry who lose their jobs due to this bill? This is actually a really important part of the bill. Yes, the bill creates a displaced worker training account, which can only be used for retraining and job placement of workers displaced by the transition to the trust. Additionally, because more people are being covered, we're going to need more people in the healthcare space in general. So hopefully we can transition a lot of those people working in insurance who probably know quite a bit about healthcare needs into the actual healthcare provider industry. If someone moves to Washington State, how long would it take to get coverage? Not long. Residence status for healthcare is defined by Medicaid in Washington. And here, this is from Washington State. A resident is someone who currently lives in Washington State and intends to continue living in Washington permanently or for an open-ended period of time, or enter the state looking for a job, or enter the state with a job commitment. So as long as you come here and you're planning to live here, you qualify for residence. It's immediately if employed or an employer moves an employee to Washington. Will I have a copay when I see the doctor? No. Will this cover hospice or long-term care? Some. The coverage will include hospice and end-of-life care, long-term care benefits at least at the standards of Medicaid coverage. The Washington Health Trust proposes long-term care benefits beyond those levels after January 2027, and this will not interfere with benefits related to other industries that maybe have this already. Will I have to pay copays for prescription drugs? Maybe. As long as you're using entirely generics, you won't. But if you're using name brand drugs where generics exist, you may still have to pay this, but it cannot exceed $250 annually. Will doctors and hospitals sign up for the payment through the Washington Health Trust? Will they see it as a good idea? Yes, the Washington Health Trust will negotiate rates with all qualified providers who wish to participate for reimbursement. The trust is obligated to negotiate budgets with nonprofit community health providers, each Washington State county, but qualified providers will be able to collectively negotiate traditional fee-for-service reimbursements. And providers will not be required to accept the reimbursements negotiated by the trust. Will the Washington Health Trust pay providers fairly? Yes. The board will work with providers to negotiate fair rates, so it should make them happier than they currently are with Medicaid and Medicare rates. And provider costs will decrease based on this due to a significant reduction in administration, specifically the administration that has to deal with insurance companies. Having only one provider, one single payer, means there's only one group to negotiate with instead of dozens of insurance companies. And lastly, the most important question, can I do anything to help? You can pledge to sign our initiative. You can sign up to volunteer. You can donate to our cause. You can print our literature and put it up where people can see it. And you can also check out our calendar at wholewashington.org/events and attend an orientation or a town hall or come to a volunteer meeting and learn what it's about. We'd love to have you there. and I hope to see you in the future.